Welcome back. It is 5:13 on this Tuesday, and it's easy to think that your kid will never face a major health scare, but kids face dangers every day, from choking hazards to broken bones. And that's why it's best to discuss how to be prepared when, not if, your kid has a major health scare.
Do you know what to do if your kid requires medical attention? It's important to be prepared in case you can't get help right away.
We're pretty much trained to leave the building within 2 minutes of receiving an alert, and then it generally takes about 5 minutes for us to arrive.
It will feel like forever for first responders to show up if your kid is in a dire situation. So, let's make sure you can keep your kid safe until you can get to a medical provider. A lost tooth seems harmless enough, but what if it's an adult tooth? Dentist Dr. Susan Maples says you need to shove the tooth back into the gums.
You'd like to get it right back up in there and hold it. So obviously you don't want one person, sitting with the child as they're on the way to the dentist. And
It's gruesome, but it'll mean that your child will keep their teeth.
it means a lifetime of dentistry in the front of your mouth, unfortunately, but we're really good at restorative solutions these days.
A button battery can be found in a lot of kids' toys and household objects, but they're incredibly dangerous if your kid swallows one. You want to get them to a hospital right away, but while you're on the way, feed them honey. Yes, honey can prevent severe damage to your kid's body. The Cleveland Clinic says 2 teaspoons of honey every 10 minutes while you are on your way to receive care. But how will you know if they have swallowed a battery? Look for a refusal to eat or drink, excessive drooling, noisy breathing, or even bloody stool, saliva, or vomiting. Be sure you keep track of how many button batteries are in your house and make sure they're kept out of reach. And finally, cardiac arrest can happen to anyone of any age, but CPR for children differs from CPR for adults. So here's what to do if your kid goes into cardiac arrest.
If they call 911, they want to check to see if the child is able to breathe at all. If the child's coughing, if the child's able to talk, they want to encourage the child to keep doing that.
If your child is unresponsive with no breathing or pulse, it's time to start CPR.
When we're going to go ahead and start compressions, we're going to put our hands right in the center of the chest, and we're going to push down, and we want to go at a rate of between 100 to 120 times per minute.
If your child hasn't yet reached puberty, do 15 compressions and 2 breaths, pinching the nose and breathing into the mouth. And if your infant becomes unresponsive,
When we feel for a pulse for an infant, it's going to be different. We're not going to feel up here in the carotid. We're actually going to feel on their arm, and we're going to feel on the brachial. That's where it's going to be the easiest for us to feel a pulse.
and CPR on an infant is different too.
There's 2 different types of compressions you can use and do in an infant, and it's either 2 fingers, just like this, or you can actually use your 2 thumbs.
You will continue to use your rescue breaths, too, at a rate of 30 compressions and 2 breaths. Mentor Fire Department also says you can use an AED if your child is still unresponsive, not breathing, and has no pulse. These are typically available in public spaces, and most will have instructions printed on the pads.
Some AEDs have different patches for pediatrics as well. They'll still connect the same way, and they'll still have pictures on where the patches need to go.
And the best thing to do in any situation is keep your child calm.
Every child's going to be different, and the parents or the caregiver is going to know them best and know what's going to be able to calm them down.
Now, to watch the entire episode, you can see Mom Squad now streaming on Roku and Fire TV. And if you don't have either one of those, you can always watch it on our WKYC YouTube page. And in the episode, we talk about other ways to prepare your family in case of emergency, including the items you need to keep in your house. It's always best to be prepared.